Hello and welcome dear learners to the Healthcare Quality Management course of NPTEL on Infection Control and Patient Safety. In today's Module 3, Patient Safety Management, Infection Control and Medication Safety, we will be focusing on infection control practices. In the part 1, we would be see the importance of infection control practices in healthcare and hand hygiene and hand washing. So as we all know, in all the healthcare organizations which are intended to have sick patients, or rather say ill patients, however, they can also be a source of infection. So how it is being seen as? There is a growing awareness that healthcare interventions can result in preventable harm to patients in form of what we call as HAIs, that is healthcare associated infections. This is known to have been contributed to significant numbers of death. It is not that infection affects only the patient, it is also a concern for the healthcare providers, that is doctors, nursing staff and even the other medical professionals. So what is the characteristics of the HAIs? A healthcare associated infection is defined by a specific time period related to a patient's stay or a procedure, not a historical era. The time frame specifies that the infection must appear during the hospitalization, generally 48 hours or more after the hospital administration. After the discharge, up to 3 days after being discharged from a hospital or surgical center. Following a procedure within 30 days of surgery or up to 90 days if an implant or a foreign body was involved. So we can say that this hospital acquired infection, or we call it as hospital acquired infection or healthcare associated infection, these are interchangeably used word, and we have been seen that it can be even to the patient as well as even to the healthcare provider. What is the importance of the infection control programs in healthcare? We will be discussing about how it is linked with HAIs. The HAIs, healthcare associated infection, are a global problem. They present infections acquired during or associated with delivery of care, in contrast to the infection present or incubating at the time of the care delivery episode. Healthcare associated infection represent one of the leading causes of death, and they cause significant morbidity among the patients who have received the healthcare. So these infections are associated with prolonged duration of care in hospitals who have been there in the hospitals for many days. Expensive use of resources often lead to unnecessary diagnostics and laboratory studies, which have made to see that these are one of stubborn problems. Increased use of therapeutic agents, which requires more reason actually for treating these HAIs. They may also impair the quality of life of the patient with the healthcare associated infection even after the treatment, where the impact can be seen at a larger level. Prevention of this HAI is therefore cost effective and achievable even when resources are limited. Can we have a solution for this HAI through this quality? Yes, it is. A well-balanced infection control program should have the hospital a considerable amount of money. For example, high rate of sepsis among patients admitted to intensive care unit can be controlled by meticulous hand hygiene and using aseptic techniques rather than by prescribing expensive antimicrobials, which may further contribute to the problems. Further, inattention to the safe injection practices can result in heterogenic transmission of bloodborne pathogens such as hepatitis C virus and HIV virus. Even carrying to this example, I would like to put it ahead. Community-based initiatives aimed at treatment of schistosomiasis in Egypt using injection of potassium intermediate between 1919 to 1982 facilitate transmission of hepatitis C virus because needles and syringes were reused without sterilization between each use. So we have numerous cases like this even in our country being noted, and we find the major causes of this is the hospital or healthcare associated infection. This infection control is the discipline concerned with preventing nosocomial infection or healthcare associated infection, a practical rather than academic subdiscipline of epidemiology. It is an essential, though often unrecognized and undersupported part of the healthcare infrastructure. Infection control and hospital epidemiology are akin to public health practice, practice within the confines of particular healthcare delivery system rather than directed at society as a whole. Infection control addresses factors related to the spread of infection within the healthcare settings, where patient to patient, from patient to staff, or from staff to patient, or among the staffs also. So, including the prevention can be via, as very importantly, first we can say is with the hand hygiene, that is called as hand washing, cleaning, disinfection, and sterilization. As a second, the hospital can take ahead to vaccination, which is being seen as a preventive part, surveillance, where you find that how many numbers of patient or hospital staff has been taken with this infection, monitoring and investigation, which is of demonstrated or suspected spread of infection within a particular healthcare setting, where surveillance and outbreak investigation is carried out, and management of this is done with the interruption of the outbreaks. So, in coming to the first strategy that we can say that can be used again this HAI is hand hygiene and hand washing. So, what is the importance of hand hygiene? Proper hand hygiene plays a crucial role in any infection control program. It has been found that it's a very important key to tackle the infection control program. To be very effective, attention must be given to hand hygiene in facilities. It can be planned in training and implementation of improved practices. All the healthcare workers and support staff must be an active participants for this. Other levels of hand hygiene? Yes, there are three key levels of hand hygiene which can be seen as a routine hand hygiene, what we do it usually for all the purposes, like what we are seeing it at a personal level, which can say that it can be taken care for the personal hygiene. What about antiseptic hand wash, which is much more towards any clinical procedure or any procedure that is even treating the patient or even contacting the patient. Prior to that, what we do is antiseptic hand wash. Then is surgical scrub. Surgical scrub is more focused towards when you are planning for a surgery ahead, or you are taking surgery, or even you are doing with any diagnostics or even interventions, surgical interventions particularly. If you are trying to take it, that level you can do the surgical scrub. So it is routine hand washing, antiseptic hand wash, and surgical scrub. Each level of hand wash contributes to all the overall effectiveness of the infection control program, and the healthcare facilities also can get more benefit actually out of this hand hygiene and hand washing. This is a picture which can demonstrate actually to you particularly for the different steps of hand hygiene which are depicted over here. From palm to palm, where you can say rub your palms together. Then at the next step you can say right palm over the left dorsum. So it can see that the rub the back of your left hand with your right palm. Where versus in the first we can say rub your palms together. So in the second position you can say towards the left side of your palm over the right dorsum. Now the rub of your right hand with the left plane. Then comes with the fingers interplace palm to palm. Rub your palms together with your fingers interface. The next step would be back of fingers to opposing palms, where rub the back of your fingers against your opposing palms with fingers interlocked, where you may see that most of the time this is the very crucial area where you find that the infections are still over there. Then comes the very important step that is called as rotational rubbing of the right thumb, where you find before a surgical scrub or even going for any diagnostics, you need to do this procedure very thoroughly. Clasp your right thumb in your left palm and rub usually rotational motion. So you will may get a rotational rubbing of this. Now the same you can do it with the left thumb, where you can clasp your left thumb in your left palm and rub it using a rational motion. Then comes the rotational rubbing of the left palm, where you can say the rub the glass of your right hand and in a rotational motion against your left palm to clean your fingertips. And lastly, again the rotational rubbing of the right palm, where if you have seen of the right, then you will have to go to the left. So rub the clasped finger of your right hand and in a rotational motion against the left palm to clean your fingertips. So this is a explained technique of hand wash. You can advise actually, you can initiate it, and you can even see that your hospital or healthcare employees take ahead these hand wash techniques. Most frequently missed or frequently missed and less frequently missed areas, we can point it out over here, where you may find that one of the most important part is the most frequently missed, where you can see it. The pictures which is giving you in a gray will show that the most frequently missed are one which is of the thumb or on the tips, and even those areas where you can. Frequently missed is one which is shown in the orange, where you may find in the pictures which is depicting over there towards you, to show that these are the frequently missed areas while hand washing. And the less frequently missed are one which are shown into white. So you may have to work more on the frequently missed one, and most frequently missed are one which you have to target it. So in this way you will be able to apply this technique, and you can encourage your hospital employees to work on this important technique of infection control program to be taken ahead. What is the need of monitoring and compliance? Every of our hospital employees has to go through this cycle, where when your infection control committee or your quality management team takes this activity in a thorough sense. Monitoring and maintenance of every high level of the healthcare worker compliance are challenging. They require specific attention for infection control professionals. And there we find the importance of the quality control team or your internal quality team. Or many times a hospital devote entire hospital in an infection control committee or quality control committee. So why have hand washing practice not worked? What is the reason that people are discouraged with this? What are the reasons actually it finds as an hindrance actually that the healthcare workers don't take this activity more serious? The risk factors for poor adherence to the recommended hand hygiene include physician status versus nurse, where you find many times this is one major issue. Nursing assistant untrained status. Male shows less commitment than females, which has been found that the diligence towards the female healthcare employees is counted to be more than versus to the male employees. Working in the intensive care unit, which is very important, that where you have to pay a thorough attention towards your hand hygiene practices. Wearing gown and gloves. Activities with high risk of cross contamination, where there is a main reasons actually you should say that you have to crab the superbugs over here. High number of opportunities for hand hygiene per hour of patient care, which is to be seen as when you are handling more patients or dealing with more patients, you need to have a high number of opportunities that you need to thoroughly work on your hand hygiene practices. These are the steps which are ruled out for the routine hand wash, where you can say the start of hand hygiene procedure, you need to remove all your jewelries. You need to have a policy of no jewelry in for your employees actually when they are working. Turn on the tap with elbow or hands actually. Don't use directly the hands. Wet hands with running water, that is a warm or tolerable water, which is one where you can directly see that your wet hands. Apply a soap agent and thoroughly distribute over hands, and make sure to all rubs parts of the hands. In the next step, you can see rub fingers together back and forth for 15 to 30 seconds, which is a standard practice. Longer if hands are visibly soiled. If they are more soiled, you need to go more longer, but not less than 15 to 30 seconds. In this very step, you should need to focus that wash the areas around the nails and remove the debris under the fingernails, because the sublingual area have a higher microbes, which is very important to be seen as. Rub all parts of the hands, paying attention to frequently missed areas, where it is very important that you need to even say this fifth practice as a very important practice in case if your hands are more soiled. There where you can see the beauty that the hands can give versus actually they can even punish by crossing infections through these hands. Rinse hands under a stream of running water until all soap is gone. You cannot put the soap and just wipe up with your cloth. So never dip hands into a basin or standing pool of water, which will be little dangerous actually. Then comes drying hands with a clean single-use towel not being used by multiple people. If possible, turn on the tap with elbows or with a paper towel after drying your hands, and not again that you are touching the same tap of the water again with your. So this ends with the hand cleans. It starts from hand hygiene procedure and it ends actually to see that your hands are completely washed, clean and dried. So these steps of routine hand wash can be displayed in a hospital or healthcare facility, where you can emphasize training and giving to a healthcare employees actually to see and follow these steps very thoroughly. They need to be encouraged actually, that if they miss, they need to be encouraged actually how thoroughly they need to go and how it really infects, how it really see that it releases or reduces the infection in the ward. The other aspects related to hand hygiene can be fingernails and artificial nails. Many times we have seen that most of the female employees, or even sometimes we have seen in employees actually who carry with grown up fingernails, or even they have some artificial nails also. Numerous studies have documented that the subungual under the nail areas of hand harbors high concentration of microorganisms, and this is the one area where you can, even for your own personal hygiene and even for infection, you can be one who can be a source of breeding infection actually. Then comes the irritant contact dermatitis. People who has actually dermatitis need to be very careful actually when they are exposed to whole lot of higher chemical soaps actually, and water can returning irritation and damage to the skin, which itself can be a great deterrent actually for them actually to go ahead on washing, and they are encouraged actually for washing. But if they have this issue, they can really find that they find it as a hindrance and they avoid it. Further, any healthcare workers may wash their hands as many as 30 times in 8 hours of shift. So this is one way we can see that you can make a culture actually for those actually who are finding a difficulty to go ahead. Waterless alcohol hand antiseptics that contain emollients can actually improve skin condition with repeated use. For people who are suffering with skin problem, they can really go with alcohol hand antiseptics. Then comes antiseptic hand wash or alcohol based hand rub. So there is always a sort of a discussion, and people usually question actually what is actually the perfect one. An antiseptic hand wash or alcohol based hand rub will reduce the concentration of the resident flora as well as inactive transient microorganism from hands. So it is better, that it is very importantly that you should ideally try to go with antiseptic hand wash. If you have difficulty with related to your skin or problem, then, and if it is affordable, definitely go for alcohol based hand rub versus to the antiseptic hand wash with waters. Hand antisepsis is achieved by hand washing with antiseptic preparations, that is adiophores or clohexidine, or by the use of alcohol based antiseptic hand rubs. When to use alcohol based hand rubs? Now, the answer is in healthcare settings where hand washing facilities are inadequate, or there is difficulty of water and availability of there, and where hands are not soiled with dirt. Many times you may find that they are not dirty in terms of soil or even mud and all those things, or heavily contaminated with blood or organisms like materials. So alcohol based hand rubs are recommended for use in such facilities, rather than not actually towards on the other side where there is a whole problem of the availability, that you may have an ample amount of water, you may have even soiled hands actually where you can use it, versus to alcohol based hand rubs are more encouraged to those facilities where you may find that is lesser they are soiled. And also in case the hands are soiled with dirt, it is necessary to hand wash routinely before the alcohol based hand rub. So you can go first with the antiseptic hand wash, thoroughly wash your hands, make it dry, and then go for alcohol based hand rub. Ideally that is more before the surgical scrub, because using alcohol alone tends to dry the skin. It is the best to use an alcohol hand rub solution by adding 2 ml of glycerin, propylene glycol or sorbitol, and 100 ml of 60 to 90% of alcohol. So in this way you can make a solution which can be more usable actually to solve your purpose, and also it doesn't affect your skin or it cannot make your skin dry. As many times we have been seen that most of the people who complain about alcohol based hand rubs is more that their skin gets dry, and in later turn they find it difficulty in handling most of the equipments or instruments. So this is the 5 moment of hand hygiene where you can be seen that before touching a patient, which is very important, or we may say before clean antiseptic procedure which starts, then after touching patient surrounding, after body fluid exposure risk, and after touching a patient. So many times it is being seen that when you have to be exposed actually to a patient, before touching the patient you should have a hand wash, or after touching the patient you should have hand wash, or sometimes when you are doing any aseptic procedure you need to clean your hands actually and then you need to start, or even after touching patient surroundings also where the patients have touched with all the other things, you need to do your hand washing. And most importantly, which is showed into the red actually, where you may find that it is that after the body fluid exposure risk actually, which is very important, that many times these are the ways actually you can see that most of the time the healthcare associated infection occur. The patient also gets most of the hospital acquired infection even through an healthcare employee. So you need to put a barrier actually to see that these all things are erased with your small and very important practices. So these are the very 5 important moments of hand washing actually, which should be displayed as a brochure actually, or can be displayed in a ward where a patient or patient relative also should try to get an awareness. They need to get more responsible, and sometimes it is being seen as a culture which develops towards hand washing. In summary to this chapter for HAIs, where I try to focus more on concentration on giving in this very first part, that how a healthcare associated infection can be dealt with hand washing, and what are the ways of hand washing, and how you need to see hand washing as a traditional versus to alcohol based scrubs. As majority of this HAI is caused of morbidity, mortality and increased healthcare cost, and you may find most of the time the major issues of morbidity are mostly due to healthcare associated infection. You may find yet they are very preventable through strong infection control practices which are at the later stage. But yes, the proper hand hygiene is a single and the most effective measure to reduce the HAIs. The reduce of HAI in terms of transmission from the healthcare settings to the patient or from the patient to the healthcare settings. So hand washing requires a correct technique which is palm to palm, dorsum, interlacing, thumb rotation and palm rotation, which is ideally to be seen when how it is shown into the picture, and you need to frequently work on developing the culture of using a correct hand hygiene technique actually. And the attention should be on frequently missed area. When you have a training which can be done on a monthly basis or even on a weekly basis, or sometimes you may have a regular training by department to department, you can even more focus particularly with respect to nurses that frequently missed areas need to be pointed, where you may reduce a infection in a particular ward which is facing a major issue of infection. The nosocomial infection can be a major reasons for a patient to have an extended length of stay. You may find most of the patients who are in the higher morbidity, or you may say comorbidity, they might be very prone actually, or immunocompromised patient can be very much prone actually of HAIs, especially patients with HIV or patients with cancer, patients with diabetes are one who are always a target actually to acquire the HIs. So complex compliance with the hand hygiene must be continuously monitored, which is a very important part of the quality control team. And you may find the infection control practices actually in a hospital cannot be taken without the support of quality management team. Even a devoted infection control committee, or even with the supervision of even a patient safety nurse. Improper or inconsistent practices led by this team or by the healthcare worker lead to heterogenic spread of pathogens like hepatitis B, hepatitis C and HIV, which are very difficult to tackle at next level. Lot of the expenses are spent more even to tackle this HAI, and the hospital has to pay a lot for this. So the Infection Control Committee, with its effective admission, we can say the aseptic technique, safe injection practices, or staff training, surveillance, and hygiene to reduce infections and save the resources that are being devoted actually for the humanity. So we can say it can be started with an individual culture, developing towards a ward and expanding towards the hospital and making the place more safety and workable, which can give an extended or I may say increase healthcare outcomes. In the references at last which are being quoted over here can be used to see in more detail actually what are the real or standard health hand hygiene practices. So thank you for today's session.